Good morning. I call to order the February 12th, 2019 meeting of the Saline County Board of Commissioners. Will the clerk please call the roll?
Commissioner Shadwick, Commissioner Sparks,
Here.
Commissioner Vidrickson,
Here.
Commissioner Weiss,
Here.
Commissioner White,
I ask that this time that you please join me and stand for a flag salute followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. This time we move to the public forum portion of our meeting where citizens may speak on county government, usually limited to 3 minutes, and also items that are not on today's agenda.
Norman Mantle, Salina. Are we moving forward on the Tri-Rivers Fairground? You're going to have another meeting with the city? Just kind of keep you guys on your toes.
Thank
Got to
you.
do something, guys.
We are aware.
Okay.
Also aware. Thank you. At this time, are there any other comments? Seeing none, I'll bring it back to the commission for regular business. Item number 1.
approve agenda for public forum as presented.
Mr. Chairman, I move we approve the agenda for the public forum as presented.
A second.
Been moved and seconded that we approve today's agenda for the public forum. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Item number 2.
Health Department update, Jason Tiller, Health Department Director.
Good morning, Jason.
Good morning, Commissioners, everybody else. So we're doing this a little bit differently. I'm using a little bit different program too than PowerPoint, so let's go. So this is our our biannual update, but we'll also be covering statistics-wise all of 2018 for most of it, just to give you a good idea of the past year. So just remember that anybody watching can connect with us through our website. We're also on Facebook, Twitter, and Instagram, and we post on those fairly regularly. And so, just as a couple of reminders, one of them, our mission at the Health Department to assess community health and status and available resources, develop policies to support and encourage better health, and ensure necessary services are provided through other entities, or by regulation or by direct provision. And this is reflective of the core tenets of public health. And our vision that we strive to be as a leader among those Kansas counties in effectively identifying, addressing, and anticipating community health needs. This is the leadership team. And then we'll look at the programs. So for child care licensing, one of the things Angela, one of our child care licensor, is on the Kansas Association for the Education of Young Children. I had to think of what all the acronym meant. And one of the projects they've worked on locally was with the police department to develop and basically refurbish the room that juveniles are held in while they're either being reunited with or held over to foster care or something like that. So it was less of a utilitarian room and more of a comforting room, especially for kids that are currently experiencing trauma at that time. So this was just the letter from the City of Salina Police Department thanking her and the agency she was working with, and Leon Montoya, our other child care licensing surveyor, is also a member of that organization for the work that they did with that. And again, most of that was on voluntary time too. This is the visits for 2018. Remember that child care licensing does cover 3 counties, Saline, McPherson, and Ottawa. And this is the breakdown of all of their visits between inspections, complaints, conducting orientations for home and for daycare centers throughout 2018. Maternal child health. This is the team over there. Come on, I just put So for the MCH program, one of the things I wanted to highlight here was the Becoming a Mom program, and we've talked about that often. In 2018, Becoming a Mom saw 880 visits or clients throughout the year of that training. Couple things I want to point out is that our Becoming a Mom program has been chosen by KDHE as to be a mentor site. So counties that are getting ready to start their own Becoming a Mom programs will come and work with our staff during class week, which is the third week of each month, on delivering the classes, the education, being mentors for them as they get their programs off the ground. Over to the right, you just have a short testimony from public health nurse out of Wyandotte County who came and spent some time with them. And I would just like to read that out loud real quick. But said, I would like to thank you both for allowing me to attend the BAM session last night. I got some great ideas and seeing it done was such a help. Then she goes on to say, as soon as she gets her manual, she'll send ours back. And then she'll be going through each session to see where she can make improvements with their setup. FYI, you both absolutely rock, and I'm so fortunate to have met you both and looking forward to a really long acquaintance and working relationship. And this is the kind of relationship statewide, too, with Becoming a Mom that we want to continue to foster. So this is just the overall statistics for MCH visits for 2018, and you can kind of see how that breaks down. In the clinic, and that's all the clinic staff. So one of the things there I really wanted to highlight is that we still have kind of an ongoing issue, and that's not just here but across the state with STDs. And during our last advisory council meeting, one of the issues that was brought up was people that were going to the emergency room for STD treatment. And just really getting that education out there and them understanding that, you know, they can come to the health department, get their STD treatment, and not end up with exorbitant additional costs like you would pay for an emergency room visit. So we did a social media campaign through our Facebook and through our other ones, but mainly on Facebook with this poster that we've had for a couple of years. We did a little update, but keep calm and get yourself tested. And we said in that post that it's confidential and a whole lot less expensive than going to the emergency room, and call us to find out how we can help. This has been our most engaging social media campaign that we have done in the last 4 years, where we reached 10,000 people. We had 493 reactions. That's every time somebody likes, does a smiley face, whatever. And it had 78 shares. And there were lots of people that not only shared it on their website or their Facebook page, but also commented on the importance of it and such like that. Really helped bring up a lot of awareness about STDs in the community and coming to the health department to get treatment for it. And you can see here, these are the statistics for the clinic visits over 2018. So we keep pushing immunizations. I'm sure most of you are aware of the measles outbreak that's occurring right now in Washington State. That could have easily been prevented had everybody been vaccinated in order to help keep down the transmission of that from it coming in. So we keep harping on immunizations. Get your shot so that you're protected and it protects everybody else, especially those who are either too young yet maybe to have their vaccinations or may have a true medical condition that prevents them from getting vaccinated. So home health, just a reminder that they have been here in the community since 1965, the longest running home health in this area. So a couple of highlights there. One, they just recently had their Medicare recertification survey, and that's a no-notice survey. They just show up about every 3 years and say, all right, here, I'm here to do the inspection and do the survey. And they receive 0 deficiencies on that survey, which is a huge deal. It means not only are they doing everything right, but they're doing it above the board because they didn't have anything to say in a negative way. One of the things I highlighted before, but just as a reminder, they were also a finalist for the Salina Journal's Best of the Best. And then Christy Ponton, the home health coordinator, completed the 2018 Local Public Health Leadership Series that's put on each year from Wichita State Community Engagement Institute as partners. And then I went through that in 2017, and then now we're getting our other leaders through that, especially as those are stepping into other leadership positions in the health department. And here's just a breakdown of their statistics. Now, this, I do want to clarify, is only for July through December. About midway through 2018, we changed up how we were collecting numbers so that it better reflected the types of visits they were doing, breaking down those numbers so that it was, instead of just RN visits, it shows how many were skilled nursing, how many were start of care, which is that initial visit, recertification, and so forth. So that's why this is only 6 months. In WIC, we have the WIC staff there. In this last year, we completed the eWIC implementation, and that has been going really well. You can see there's a picture again of the WIC Shopper app on the left. And then this graph just shows the caseload. It spiked up during the summer, which may or may not have been just because of the newness of the eWIC system. We don't really know just yet. And then it kind of leveled back down. So we're pretty close to where we started at the beginning of the year with caseload. So that really hasn't changed much. But they continue to stay busy over there. And this here is just a reflection of the 2018 stats. All right, in preparedness and health education, I use this graphic because it truly does take teamwork in order to be able to take care of the areas of preparedness and health education amongst all of the departments. So I want to talk a little bit about the community flu clinic, and just as a reminder, we use that each year as a practice for POD, or point of dispensing, if we ever were have a biological attack of some sort, or we had to do a mass vaccination, and as there were several years ago for swine flu, bird flu, something like that, H1N1. At that event, we gave 463 flu shots, both inside and outside, and we've given closer now to 1,200 flu shots to date at the health department. And then recently, too, we just did a training with the CERT team through emergency management on these POD operations, because on a large scale, it would take additional support from emergency management, CERT volunteers, in order for us to be able to dispense medication or vaccinations to 55,000 people. In the preparedness realm, we've also have been doing Stop the Bleed training. We did that with all the county staff last year, and then actually just last month in January, we did it with K-State Extension Office with some of their staff. And this is just getting that life-saving skills and knowledge out there so that if somebody is severely injured, does have life-threatening bleeding, then at least lay people can be able to provide that life-saving, death-preventing treatment to them. Under the umbrella of Academic Health Department, we continue to grow our associations and our partnerships with like KWU, Fort Hays State University. In 2018, we had 6 RN students that came through doing OJT of various types. And then we had a Master's Public Health student last year, and we're already on track to have another MPH student this year for an internship. And then our partnership with KU Nursing Program has started off, and I have Schwai here with me, who is a KU nursing student who is observing this process this morning and will be working with us for 3 more weeks. Right. So sometimes, depending on the nursing program, they may work with us for a day. KU has them working with us 2 days a week over 6 weeks. So the administration, which is the gears and the glue that keep everything else running for all of the maintenance, the facilities, billing, financial, everything right there. And then lastly, I just want to talk a little bit about the road ahead. One of them is that we're looking at implementing community-based system that's called IRIS, which is the Integrated Referral and Intake System. It's managed by KU, and it's a HIPAA-compliant, cloud-based system for being able to do referrals, and actually greatly increases efficiency, and we've been in conversations with other counties that are currently using it, and there'll be a presentation here in the next 2 or 3 months on this as we move a little bit more forward with it. We're going to continue working on developing our strategic plan and continue to build and maintain community partnerships. And the last thing I want to show you is just that these are all the different councils and committees and boards that our staff serve on as part of their commitment and their work towards community improvement. So in addition to all of the visits that they do, the patients that they see, this is where a lot of the work happens for the greater community as well. And if you'll notice, several of them serve in leadership positions on some of these boards and councils as well. So as it is in our vision, where our vision is to be a leader in Kansas City and counties in public health, this is one way that we are helping to achieve that vision. So that concludes my update for this morning. Is there any questions at this time?
Well, thank you, Jason. It's well detailed, and looks like everything's rolling along fairly smoothly at the
Yes,
at the
sir.
health department. So, questions or comments from fellow?
Congratulations on all the achievements you guys have done this year.
Thank
So,
you.
Wow, it's a neat to see and hear.
Yep.
Okay. Well, thank you very much. That brings us to the our full agenda for the day in this abbreviated meeting. Only one item on the agenda, actually a couple there. So, is there any other business to be brought before the commission, or announcements, comments, commissioners? Okay, we will follow this meeting with a short update from the administrators. So, I would entertain a motion for adjournment.
So moved.
Second.
Been moved and seconded that we adjourn today's meeting. All those in favor say aye.
Aye.
Opposed, same sign. We're adjourned.